Marcus Chen stared at the diamond-encrusted collar in his trembling hands, his eyes wide with disbelief. What he had discovered attached to this dying dog's neck would change everything he thought he knew about wealth, power, and the true meaning of loyalty. But this story doesn't begin with the shocking revelation that would shake the foundations of one of Chicago's most powerful families. Before we jump back in, tell us where you're tuning in from, and if this story touches you, make sure you're subscribed, because tomorrow, I've saved something extra special for you. It begins 3 hours earlier, in the cramped waiting room of Riverside Animal Clinic, where the most unlikely rescue was about to unfold. The fluorescent lights hummed overhead as Marcus wiped down the examination table for what felt like the 100th time that day. His worn scrubs bore the evidence of another long shift at Riverside Animal Clinic, the kind of neighborhood veterinary practice that survived on routine checkups and the occasional emergency. The waiting room beyond the thin door buzzed with the usual afternoon crowd: elderly Mrs. Patterson with her arthritic tabby, the young couple nervously clutching their first puppy, and a handful of other pet owners who chose this clinic not for its prestige, but for its affordability. Marcus had been working at Riverside for 18 months now, ever since he and his 7-year-old daughter Emma had moved to this modest neighborhood on Chicago's South Side. The job paid just enough to cover their small apartment rent and Emma's school supplies, with little left over for luxuries. Most days, Marcus arrived at the clinic by 7 in the morning and didn't leave until well past 6 in the evening, maximizing his hours as a veterinary assistant to make ends meet. The other staff members appreciated his quiet competence and his gentle way with frightened animals, though none of them knew much about his background beyond the basics he'd shared during his interview. What they couldn't have guessed was that the man who cleaned kennels and restocked supply cabinets had once commanded fees of $15,000 for a single surgical procedure. In his previous life, Dr. Marcus Chen had been one of the most sought-after veterinary surgeons on the West Coast, specializing in complex cardiac procedures that other vets declared impossible. His hands, now rough from scrubbing floors and mixing disinfectant, had once performed microsurgery that saved the lives of championship racehorses and beloved family pets whose owners flew in from across the country seeking his expertise. The transition from renowned surgeon to veterinary assistant had been anything but easy. There were moments, usually late at night when Emma was asleep, when Marcus would find himself questioning every choice that had led him to this point. He missed the intellectual challenge of complex diagnoses, the satisfaction of performing procedures that pushed the boundaries of veterinary medicine, and yes, the financial security that had once allowed him to provide Emma with every advantage. But those moments of doubt always faded when he remembered why he had walked away from that world entirely. Emma burst through the clinic's front door at exactly 3:15, her backpack bouncing against her shoulders as she ran toward the reception desk. This had become their daily routine since starting at Riverside. Emma would walk the 4 blocks from Lincoln Elementary to spend her after-school hours at the clinic, doing homework in the break room and helping with small tasks that made her feel important. The other staff members had grown fond of the bright, curious girl who could calm nervous pets with her gentle voice and seemed to have inherited her father's natural way with animals. "Dad, guess what happened at school today?" Emma announced, dropping her backpack beside the reception counter where Marcus was updating patient files. Her eyes sparkled with the kind of excitement that only 8-year-olds could muster over everyday discoveries. Preparing and narrating this story took us a lot of time, so if you are enjoying it, subscribe to our channel. It means a lot to us. Now, back to the story. "Tell me everything," Marcus replied, setting down his pen and giving Emma his full attention. This was another thing that had changed since their move to Chicago. In his previous life, consumed by the demands of his surgical practice, Marcus had often been too distracted or exhausted to truly listen when Emma shared the details of her day. Now these after-school conversations had become sacred time, moments when he could be fully present as a father rather than a surgeon racing between emergencies. Emma launched into an animated description of her science project on animal habitats, complete with dramatic gestures that made Marcus smile despite his fatigue. As she spoke, he found himself marveling at how resilient children could be. Emma had adapted to their new circumstances with a grace that humbled him daily. She never complained about their smaller apartment, never asked why they couldn't afford the extracurricular activities her classmates enjoyed, never questioned why her father now worked as an assistant rather than running his own practice. The afternoon wore on with its usual rhythm of routine appointments and minor procedures. Marcus assisted Dr. Sarah Rodriguez, the clinic's owner, with a dental cleaning on an elderly beagle, helped restrain a squirming kitten during its vaccinations, and spent 20 minutes patiently explaining medication instructions to a worried pet owner whose English was limited. These were not the cases that would make medical journals or earn professional accolades, but Marcus had learned to find satisfaction in the simple act of helping, regardless of the complexity of the problem. As closing time approached, Marcus began his end-of-day routine of cleaning examination rooms and securing the medication supplies. Emma sat at the reception desk, carefully coloring a drawing she had started during a quiet moment between appointments. The drawing depicted a man in a white coat kneeling beside a large dog, and even rendered in crayon there was something unmistakably tender about the scene she had captured. "Is that supposed to be me?" Marcus asked, glancing over Emma's shoulder at her artwork. "It's you helping Buster feel better," Emma replied, referring to a German shepherd who had been a regular patient during his recovery from hip surgery. "You always know exactly how to make the animals feel safe." The simple observation struck Marcus more deeply than Emma could have known. In his previous career, he had been praised for his technical skill, his innovative surgical techniques, his ability to achieve outcomes that other surgeons couldn't match. But Emma's praise was different. She saw him not as a brilliant surgeon, but as someone who cared deeply about relieving suffering, regardless of whether that suffering belonged to a champion thoroughbred or a neighborhood stray. As Marcus locked up the clinic and walked home with Emma, neither of them could have imagined that tomorrow would bring the kind of emergency that would test everything he thought he had left behind. The emergency call came at 6:47 in the morning, piercing through the quiet of Marcus's small apartment like a fire alarm. He fumbled for his phone, squinting at the unknown number flashing on the screen. Working at a neighborhood clinic meant emergency calls were rare, but when they came, they were usually serious. "Riverside Animal Clinic. This is Marcus," he answered, his voice still thick with sleep. "Thank God someone answered," came a frantic woman's voice on the other end. "My name is Patricia Wells. I'm calling about my employer's dog. There's been a terrible accident, and we need help immediately. The regular veterinary hospitals are all closed, and your clinic was the only place that answered." Marcus sat up straighter, instantly alert. "What kind of accident? What are the dog's symptoms?" "It's a golden retriever named Apollo. He was hit by a delivery truck about 20 minutes ago in Lincoln Park. He's breathing, but barely. There's blood, and he's not responding to us at all. My employer is beside himself. Money is no object. We just need someone who can help." The desperation in Patricia's voice was unmistakable, and Marcus felt the familiar surge of adrenaline that had once driven him through countless emergency surgeries. "Bring him in immediately. I'll meet you at the clinic in 15 minutes. Keep the dog as still as possible during transport, and if you have a blanket, wrap him gently to prevent shock." As he hung up, Marcus was already moving, pulling on his clothes with practiced efficiency. He paused at Emma's bedroom door, watching her sleep peacefully in the early morning light. His neighbor, Mrs. Garcia, had agreed months ago to be his emergency contact for situations exactly like this. A quick phone call arranged for Emma to be looked after until he could return. The streets of Chicago were still relatively quiet as Marcus drove toward the clinic, his mind automatically running through trauma protocols he hadn't used in years. Golden retrievers were large dogs, which meant internal injuries could be severe after a collision with a vehicle. Depending on the impact site, they could be looking at anything from broken ribs and internal bleeding to spinal injuries or traumatic brain injury. The fact that the dog was barely breathing suggested possible pneumothorax or severe pain shock. Marcus arrived at Riverside Animal Clinic just as a black luxury sedan pulled up to the curb. The car was followed immediately by a second vehicle, a white Mercedes SUV that looked like it cost more than Marcus earned in 2 years. From the sedan emerged a woman in her 50s, impeccably dressed despite the early hour, her perfectly styled hair contrasting sharply with the panic in her eyes. This had to be Patricia Wells. But it was the man who stepped out of the Mercedes who commanded immediate attention. Even in crisis, Alexander Blackstone carried himself with the unmistakable presence of someone accustomed to controlling every situation he encountered. Marcus recognized him instantly from newspaper photos and business magazine covers. Blackstone Industries was one of Chicago's largest real estate development companies, and Alexander Blackstone was known throughout the city as a man who built skyscrapers and shaped neighborhoods with equal ruthlessness. "Are you the veterinarian?" Blackstone demanded, his voice sharp with anxiety and authority. "I'm Marcus Chen, veterinary assistant at this clinic," Marcus replied, unlocking the front door quickly. "Let's get your dog inside immediately." Blackstone's expression shifted slightly at the word assistant, but the urgency of the situation left no time for questions. Together, they carefully lifted Apollo from the back seat of the Mercedes. The golden retriever was a magnificent animal, probably weighing close to 90 pounds, with a coat that spoke of premium breeding and excellent care. But now he lay limp and unresponsive in their arms, his breathing shallow and labored. As they carried Apollo into the clinic, Marcus's trained eye was already assessing the damage. There was blood matted in the dog's fur along his left side, suggesting impact trauma to the ribs and possibly the abdomen. More concerning was the dog's color. His normally pink gums were pale, indicating possible internal bleeding or shock. Apollo's eyes were open but unfocused, and he showed no response to being moved or touched. "What happened exactly?" Marcus asked as they placed Apollo on the examination table in the clinic's main treatment room. Patricia Wells spoke rapidly, her words tumbling over each other in her urgency to explain. "Mr. Blackstone takes Apollo for a walk in Lincoln Park every morning at 6:30. It's their routine, has been for 3 years. This morning, Apollo saw a squirrel and broke free from his leash. He ran directly into the street, just as a delivery truck was coming around the corner. The driver couldn't stop in time." Marcus nodded, his hands already beginning a systematic examination of the injured dog. Apollo's pulse was rapid and thready, confirming his suspicion of shock. There was definite swelling along the left rib cage, and when Marcus gently palpated the abdomen, Apollo whimpered, the first sound he had made since arriving. "The nearest emergency veterinary hospital is Midwest Animal Emergency on the north side," Marcus said, looking up at Blackstone. "They have surgical facilities and specialists who can handle trauma cases like this. I can call them and let them know you're coming." Blackstone's response was immediate and sharp. "We've already called them. They're completely booked with emergency surgeries until this afternoon." The receptionist said the earliest they could see Apollo would be 2 o'clock. Maybe later. This dog doesn't have that long. Marcus felt his stomach tighten. 2 o'clock was more than 7 hours away. Looking at Apollo's condition, he wasn't sure the dog would survive even 2 more hours without intervention. The pale gums were getting worse, and the dog's breathing was becoming more labored by the minute. "What about Chicago veterinary specialist downtown?" Marcus suggested, though even as he spoke, he suspected he knew the answer. Patricia shook her head. "Same story. There was a multi-car accident last night involving several dogs. Every emergency facility in the city is overwhelmed." Alexander Blackstone stepped closer to the examination table, his usual commanding presence replaced by something Marcus had rarely seen in powerful men: genuine vulnerability. "This dog isn't just a pet," he said quietly. "Apollo belonged to my daughter Sarah. She died 2 years ago in a car accident, and this dog is all I have left of her. I'll pay anything, do anything. Please tell me there's something you can do." The revelation hit Marcus like a physical blow. Suddenly, this wasn't just about treating an injured animal. This was about a father's love, about grief and memory and the desperate need to hold on to something precious. Marcus understood that pain in ways that Alexander Blackstone couldn't possibly know. Looking down at Apollo, Marcus could see the dog's condition deteriorating in real time. The abdominal swelling was increasing, which likely meant internal bleeding. The dog's breathing was becoming more shallow and rapid, suggesting possible fluid in the chest cavity. Without immediate intervention, Apollo would die on this table within the next hour. Dr. Rodriguez, the clinic's owner, didn't have the equipment or expertise for major trauma surgery. The clinic was designed for routine procedures, vaccinations, and minor treatments. They had basic surgical tools, but nothing like what would be needed for the kind of complex internal repairs Apollo required. Marcus found himself at an impossible crossroads. He had the knowledge and skill to save this dog's life, but he had spent the last 18 months carefully constructing a life where those abilities remained hidden. Using them now would mean revealing everything he had worked so hard to leave behind. It would mean exposing himself to questions he wasn't ready to answer and reopening wounds that had taken years to begin healing. But as he looked at Alexander Blackstone's face, seeing a father's anguish that mirrored his own past pain, Marcus realized that some choices weren't really choices at all. "I need to make a phone call," Marcus said quietly. "Patricia, can you monitor Apollo's breathing and let me know immediately if it changes?" "Mr. Blackstone, I need you to trust me for the next few minutes." As Marcus stepped into the clinic's small office, he wasn't calling another veterinary hospital. He was calling the one person who might be able to help him access the equipment and supplies he would need to perform surgery that officially he had no business attempting. The next few minutes would determine whether Apollo lived or died, but they would also determine whether Dr. Marcus Chen, the surgeon, would emerge from the shadows where Marcus Chen, the assistant, had been hiding for the past 18 months. The phone call Marcus made changed everything in 30 seconds. Dr. Elena Rodriguez had been sleeping when her phone rang, but the urgency in Marcus's voice brought her instantly awake. As the owner of Riverside Animal Clinic, she had always sensed there was more to her quiet, competent assistant than he let on, but she had never pressed for details. Now, hearing him request emergency surgical supplies and equipment with the precise terminology of someone who understood exactly what he needed, those suspicions crystallized into certainty. "Marcus, what are you not telling me?" Dr. Rodriguez asked directly. "You're talking like someone who's performed major surgery before." There was a pause that seemed to stretch forever before Marcus responded. "Elena, I need you to trust me right now. There's a dog here who will die in the next hour without immediate surgical intervention. I have the knowledge to save him, but I need your permission to use your operating room and surgical supplies." 20 minutes later, Dr. Rodriguez arrived at the clinic to find a scene that defied everything she thought she knew about her employee. Marcus had already begun preparing Apollo for surgery with a level of precision and confidence that spoke of years of experience. He had inserted an IV line with expert efficiency, administered pain medication and antibiotics, and was now carefully shaving the surgical site along Apollo's abdomen and chest. Alexander Blackstone stood against the far wall, his expensive suit rumpled and his usually perfectly styled hair disheveled from running his hands through it repeatedly. Patricia Wells sat in a corner chair, her phone pressed to her ear as she made what sounded like arrangements for the aftermath of the surgery, whatever that might bring. "Mr. Blackstone," Marcus said without looking up from his preparations, "I need to explain something before we proceed. I am not just a veterinary assistant. I'm a fully licensed veterinary surgeon, but I haven't practiced surgery in almost 2 years. What your dog needs is a complex procedure to repair internal bleeding and possibly remove damaged tissue. There are risks involved, and I want you to understand them completely." Blackstone stepped forward, his businessman's instinct for reading people telling him that something fundamental had shifted in the room's dynamics. "What kind of risks?" Marcus finally looked up, meeting Blackstone's eyes directly. "Apollo has internal bleeding, likely from a ruptured spleen or liver laceration. He also has at least 3 broken ribs, and there's fluid in his chest cavity that's making it difficult for him to breathe. The surgery will take approximately 2 hours, and even if everything goes perfectly, his recovery will be touch and go for the next 48 hours. The clinical assessment was delivered with the calm authority of someone who had made similar pronouncements hundreds of times before. Dr. Rodriguez watched in amazement as Marcus continued his explanation, using medical terminology with the fluency of a specialist. "However," Marcus continued, "without surgery, Apollo will be dead within the hour. The internal bleeding is getting worse, and his blood pressure is dropping steadily. We've reached the point where doing nothing is not an option." Blackstone nodded grimly. "Do whatever you have to do. Cost is not a factor." What happened over the next 2 hours transformed everyone's understanding of who Marcus Chen really was. Once he began the actual surgery, it became clear that they were witnessing someone operating at the highest levels of veterinary medicine. His hands moved with absolute precision, each incision calculated and deliberate. When he opened Apollo's abdominal cavity and discovered the extent of the internal damage, his response was immediate and confident. "Splenic laceration, grade 4, he announced to Dr. Rodriguez, who was assisting despite her growing amazement. "We'll need to remove the damaged portion and repair the vessel. Elena, I need you to maintain pressure here while I isolate the bleeding." Dr. Rodriguez had been practicing veterinary medicine for 15 years, but she had never seen surgical technique like this. Marcus's movements were economical, and sure, his understanding of the anatomy absolute. When they discovered that one of Apollo's broken ribs had punctured his lung, Marcus repaired the damage with a confidence that spoke of extensive experience with similar cases. "How long have you been doing surgery like this?" Dr. Rodriguez whispered during a brief pause in the procedure. 15 years, Marcus replied simply, his focus never wavering from his work. "I specialized in trauma surgery and cardiac procedures." The revelation sent shockwaves through everyone present, but it was Alexander Blackstone's reaction that surprised everyone most. Instead of anger at being deceived about Marcus's qualifications, he seemed almost relieved. For the first time since arriving at the clinic, he allowed himself to believe that Apollo might actually survive. As the surgery progressed, Marcus demonstrated skills that went far beyond general veterinary practice. When Apollo's blood pressure dropped dangerously during the procedure, Marcus administered precisely calculated doses of medications that stabilized the dog's condition. When the chest tube he inserted to drain fluid from Apollo's lungs became blocked, he cleared it with the practiced efficiency of someone who had dealt with similar complications countless times. But it was during the most critical moment of the surgery that Marcus's true expertise became undeniable. Apollo's heart rhythm became irregular, a dangerous arrhythmia that could prove fatal. Without hesitation, Marcus began cardiac massage, his hands working to manually maintain the dog's circulation, while Dr. Rodriguez prepared emergency medications. "Elena, I need 0.5 milligrams of epinephrine and prepare the defibrillator," Marcus instructed calmly, his voice showing none of the panic that was beginning to creep into everyone else's expressions. "We don't have a defibrillator," Dr. Rodriguez replied, her voice tight with concern. Marcus didn't pause in his cardiac massage. "Then we do this manually. Patricia, I need you to time my compressions. 30 seconds on, 10 seconds off. Elena, administer the epinephrine on my mark." For the next 10 minutes, Marcus manually kept Apollo alive through sheer skill and determination. His compressions were perfectly timed and positioned, maintaining enough circulation to keep Apollo's brain and vital organs oxygenated while his heart struggled to resume normal rhythm. When Apollo's heartbeat finally stabilized, the silence in the room was profound. Alexander Blackstone had watched the entire procedure with the fascination of someone witnessing something he had never imagined possible. As a businessman, he was accustomed to evaluating talent and expertise, but what he had just observed went beyond anything he had encountered in the corporate world. This was artistry combined with science, performed under life-or-death pressure by someone who had initially presented himself as merely an assistant. When Marcus finally began closing the surgical incisions, his movements were as precise and careful as they had been at the beginning of the procedure. Each suture was placed with mathematical precision, ensuring optimal healing and minimal scarring. As he worked, he explained to Dr. Rodriguez the aftercare that Apollo would require, the medications that would be needed, and the signs to watch for that would indicate complications. "The next 24 hours will be critical," Marcus said, as he completed the final suture. "Apollo needs to be monitored constantly for signs of infection, bleeding, or respiratory distress. His pain management will be crucial for proper healing, and he'll need to be kept absolutely still for at least a week." As Apollo was moved to a recovery area and connected to monitoring equipment, the reality of what had just occurred began to sink in for everyone present. Patricia Wells stared at Marcus with something approaching awe, while Dr. Rodriguez found herself reassessing everything she thought she knew about her employee. But it was Alexander Blackstone who finally voiced what everyone was thinking. "Who are you, really?" he asked quietly. "And why are you working as an assistant when you're clearly one of the most skilled surgeons I've ever seen?" Marcus looked down at Apollo, now breathing steadily and showing the first signs of emerging from anesthesia. The dog that had been dying on the examination table 2 hours earlier was now stable and on the road to recovery. The surgery had been a complete success, but Marcus knew that saving Apollo's life had cost him the anonymity he had worked so hard to maintain. "My name is Dr. Marcus Chen," he said finally. "Until 2 years ago, I ran the most successful veterinary surgical practice on the West Coast. I specialized in procedures that other vets said were impossible, and I charged accordingly. I had everything that's supposed to matter: reputation, money, recognition in my field." He paused, checking Apollo's vital signs one more time before continuing. "But success in surgery means that sometimes, despite your best efforts, you lose patience. And sometimes, The patient you lose is the one that matters most. The silence in the recovery room stretched like a held breath as Marcus checked Apollo's monitors one final time. The golden retriever's vital signs were strong and steady, a testament to the masterful surgery that had just saved his life. But Marcus knew that the hardest part of this day wasn't behind him. It was standing right in front of him, in the form of three people whose entire perception of him had been shattered in the span of 2 hours. Dr. Rodriguez was the first to break the silence. "Marcus, I've worked with dozens of veterinarians over the years. What I just witnessed wasn't just competent surgery. That was the work of someone who's performed thousands of complex procedures. The way you handled the cardiac episode, the precision of your technique, the medications you knew to use, where did you learn to operate like that?" Marcus pulled off his surgical gloves and disposed of them carefully, buying himself a few more seconds to organize thoughts he had spent 18 months trying to suppress. When he finally spoke, his voice carried the weight of memories that had shaped every decision he had made since arriving in Chicago. "I graduated from UC Davis School of Veterinary Medicine 20 years ago, top of my class. Did my residency at the Animal Medical Center in New York, then specialized in cardiovascular and trauma surgery at the University of Pennsylvania. By the time I was 32, I had my own practice in San Francisco, Chen Veterinary Surgical Associates. We handled the most complex cases on the West Coast, the ones other vets wouldn't touch." Alexander Blackstone listened intently, his businessman's mind already calculating the implications of what he was hearing. "That level of practice, that kind of reputation, those fees probably made you wealthy." Marcus nodded slowly. "More than I ever thought possible growing up. We charged $15,000 for routine cardiac procedures, sometimes $50,000 for experimental surgeries. My patient list included championship racehorses, show dogs worth hundreds of thousands of dollars, and pets belonging to celebrities and tech billionaires. I had a staff of 12, state-of-the-art surgical facilities, and a waiting list that stretched 6 months." Patricia Wells shifted in her chair, clearly struggling to reconcile this description with the man she had known as a quiet clinic assistant. "Then why are you here? Why are you working for minimum wage when you could be running your own practice again?" The question hung in the air like smoke, and Marcus felt the familiar tightness in his chest that always accompanied thoughts of his former life. He walked to the window overlooking the clinic's small parking lot, where Emma would arrive in a few hours, expecting to find her father living the same humble life she had always known. "I was married to Dr. Jennifer Liu, my surgical partner, and the finest veterinarian I've ever known. She was brilliant, compassionate, and completely dedicated to saving animals that everyone else had given up on. We met during our residency, built our practice together, and had planned to spend our lives pushing the boundaries of what veterinary medicine could accomplish." Marcus's voice grew quieter, and Dr. Rodriguez found herself leaning forward to catch every word. "Jennifer was also the most beautiful person I've ever known, inside and out. When we learned we were going to have a baby, we thought our lives were perfect. We had successful careers, financial security, and now we were starting a family together." He paused, watching a delivery truck navigate the narrow street outside. Emma was born on a Tuesday in March, 8 pounds and 3 ounces of absolute perfection. Jennifer took 6 weeks off from surgery, the longest break she had taken since opening our practice. But she was anxious to get back to work, especially to a case we had been consulting on for months. Alexander Blackstone sensed the direction the story was taking, and his expression softened with the recognition of shared grief. "What happened?" "There was a 7-year-old German Shepherd named Max, who had been born with a complex congenital heart defect. 3 different surgical teams had declared his condition inoperable, but Jennifer believed she could devise a procedure that would give him a normal life. She had spent months studying his case, developing a surgical approach that had never been attempted before." Marcus turned back to face the others, his eyes bright with unshed tears. "The surgery was scheduled for a Thursday morning. Emma was 10 weeks old, and I stayed home with her while Jennifer went in early to make final preparations. The procedure was supposed to take 4 hours. Jennifer called me at noon to say everything was going perfectly, that Max was responding better than she had hoped." Dr. Rodriguez felt her heart sink, knowing instinctively that this story would not have a happy ending. Something went wrong. The anesthesia machine malfunctioned during the final stage of the surgery. There was a gas leak that nobody detected until it was too late. Jennifer and her surgical assistant were both overcome by the fumes. The assistant survived, but Jennifer had been standing directly over the machine when it failed. By the time the emergency team reached her, she had been without oxygen for almost 8 minutes. The words came out in a rush now, as if speaking them quickly would make them hurt less. She was in a coma for 3 weeks. The doctor said her brain had been too severely damaged, that even if she woke up, she would never be the same person. I sat by her bedside every day, holding Emma and talking to Jennifer about all the surgeries we would perform together when she recovered, all the animals we would save. Patricia Wells wiped tears from her eyes, understanding now why Marcus had shown such fierce determination to save Apollo. She never woke up. She died on a Sunday morning while I was changing Emma's diaper in the hospital room. One moment she was breathing with the help of machines, and the next moment she was gone. The irony was devastating. Jennifer had dedicated her life to saving animals, and she died trying to save one more. Alexander Blackstone stood quietly, his own memories of loss making him acutely aware of the pain Marcus was reliving. What happened to Max, the dog she was operating on? Marcus managed a small, sad smile. He survived. The procedure Jennifer developed worked perfectly. Max lived for another 6 years with a completely normal heart. Jennifer's innovation saved his life and has since been used to help dozens of other dogs with similar conditions. Her technique is now taught in veterinary schools across the country. The revelation added another layer of tragedy to the story, the knowledge that Jennifer's death had at least resulted in medical advances that would help future patients. But Dr. Rodriguez could see that this knowledge provided little comfort to the man who had lost his wife and partner. I tried to continue the practice for Emma's sake, but every time I walked into our surgical suite, I saw Jennifer lying unconscious on the floor. Every procedure reminded me of what we had lost, what Emma would never know about her mother. I made mistakes, lost confidence, couldn't focus. After 6 months, I realized I was becoming dangerous to my patients. Marcus sat down heavily in one of the recovery room chairs, the weight of his memories making him look older than his 41 years. I sold the practice, settled Jennifer's medical bills, and put the rest of the money into a trust fund for Emma's education. Then I packed our belongings and drove east until I found a place where nobody knew Dr. Marcus Chen, the famous surgeon. "But why hide your abilities completely?" Dr. Rodriguez asked gently. "You could have found work at another surgical practice, maybe taken a less demanding position while you grieved. Because being a surgeon meant being responsible for life and death decisions every day, and I had lost faith in my ability to make those decisions correctly. When Jennifer died, I felt like I had failed at the most important surgery of my life, even though I wasn't even in the operating room. I convinced myself that if I couldn't save the person who mattered most to me, I had no business trying to save anyone else." The explanation resonated with a logic born of grief and trauma, the kind of reasoning that made perfect sense to someone drowning in loss but would seem irrational to outside observers. Alexander Blackstone understood this better than most, having made his own questionable decisions in the aftermath of his daughter's death. "So you became Marcus Chen, the veterinary assistant, working at neighborhood clinics for hourly wages, never letting anyone know what you were capable of," Patricia summarized. "It seemed safer that way. I could still be around animals, could still help in small ways, but without the pressure and responsibility that comes with being the surgeon everyone depends on to perform miracles. I told myself I was protecting Emma from the possibility of losing another parent to a profession that demanded everything." Dr. Rodriguez shook her head in amazement. "Marcus, what you just did to save Apollo wasn't the work of someone who has lost his abilities. That was masterful surgery performed under emergency conditions with limited equipment. You saved that dog's life with skills that most veterinarians could never match." Alexander Blackstone stepped closer to the recovery area where Apollo was beginning to show signs of awakening from anesthesia. "Dr. Chen, I owe you a debt that I can never repay, but I have to ask, what made you decide to operate today? What changed after 18 months of hiding your abilities?" Marcus looked through the window toward the street where Emma would walk from school in a few hours, trusting that her father would be there waiting for her, as he had been every day since they had arrived in Chicago. "I looked at your face when you talked about Apollo being all you had left of your daughter, and I recognized that expression. It was the same one I saw in the mirror every morning for months after Jennifer died. I realized that some things are more important than protecting yourself from pain." The admission hung in the air like a benediction, The acknowledgement that love sometimes requires risk, that healing sometimes demands the very action we most fear taking. As Apollo stirred and opened his eyes for the first time since the accident, Marcus felt something shift inside his chest, a loosening of the tight knot of grief and fear that had been his constant companion for almost 2 years. 3 days after Apollo's surgery, Alexander Blackstone returned to Riverside Animal Clinic with an offer that would have changed most people's lives forever. The golden retriever had made a remarkable recovery, his tail wagging weakly as he recognized Marcus's voice in the recovery room. But it wasn't just gratitude that brought the billionaire back to the modest neighborhood clinic. "Dr. Chen, I've spent the last 72 hours learning everything I can about your background," Blackstone began, settling into the chair beside Apollo's kennel. "Your reputation in San Francisco was legendary. I've spoken with colleagues who still consider you the finest trauma surgeon they've ever encountered." Marcus continued checking Apollo's surgical sites, noting with satisfaction that the healing was progressing perfectly. "Mr. Blackstone, I appreciate your research, but I've already told you why I left that world behind." "Which is exactly why I want to make you an offer," Blackstone replied, pulling out a formal document from his briefcase. "I'm prepared to fund a completely private veterinary hospital with you as the chief surgeon, unlimited budget, state-of-the-art equipment, your choice of staff. The only condition is that you focus exclusively on cases like Apollo's, animals that other vets have given up on." The offer was staggering in its scope and generosity. Dr. Rodriguez, who was listening from across the room, felt her breath catch. This was the kind of opportunity that came once in a lifetime, the chance to build something extraordinary from the ground up. The salary would be $2 million annually, plus full benefits and profit sharing, Blackstone continued. Emma would have access to the finest schools in Chicago, college fully funded, whatever she needs. You could return to the work you were born to do, but on your own terms. Marcus set down his stethoscope and looked directly at the man who was offering him everything he had once possessed and lost. "Mr. Blackstone, your generosity is overwhelming, but I have to decline." The refusal sent shockwaves through everyone present. Patricia Wells, who had witnessed the miracle of Apollo's surgery, stared in disbelief. Dr. Rodriguez felt compelled to speak up. "Marcus, this is an incredible opportunity. You could help thousands of animals, train the next generation of surgeons, make contributions to veterinary medicine that could change the field forever." "You're absolutely right," Marcus agreed, his voice calm and certain. "But I've learned something important over the past 18 months. Being Emma's father isn't something I do in addition to being a surgeon. It's the most important work I'll ever do, and it deserves my complete attention." Alexander Blackstone leaned forward, his businessman's instinct telling him there had to be a way to negotiate. "We could arrange flexible schedules, on-site childcare, whatever you need to balance both responsibilities." Marcus shook his head gently. "It's not about logistics, Mr. Blackstone. When I was running my practice in San Francisco, I thought I was balancing everything perfectly. But the truth is, Jennifer was carrying most of the parenting load while I focused on building my reputation. I missed Emma's first steps because I was in surgery. I missed her first word because I was at a conference." He paused, watching Apollo lift his head to look around the recovery room with increasing alertness. "After Jennifer died, I realized that Emma had already lost one parent. I wasn't going to let ambition take away the second one, even partially." The explanation resonated with Alexander Blackstone in ways Marcus couldn't have anticipated. The billionaire had built his empire while his own daughter Sarah was growing up, always promising himself he would spend more time with her when the next deal was finished, when the next building was completed. "I understand your choice more than you know," Blackstone said quietly. "But what if there was a way to honor both commitments? What if you worked here at Riverside? But I funded expansions that would allow you to take on complex cases while maintaining your current schedule." It was Dr. Rodriguez who answered first. "Marcus, that could work. We could add surgical capabilities, bring in advanced equipment, but keep the community focus that makes this place special." Marcus looked around the small clinic that had become his sanctuary, then thought about Emma waiting for him at home, probably working on another drawing of animals he had helped heal. "Elena, if you're willing to expand the practice, I'd be honored to return to surgery on a limited basis, but my priority will always be being present for Emma." As Apollo stood shakily in his